Hello, I'm Michael Brawer. I'm VP of Medical Affairs at Myriad Genetics Laboratory. I'd like to share with you a couple of what I think are pretty new things that we have coming out. And this is our report of the largest study in conservatively managed men with prostate cancer who had our Prolaris test, which is a prostate cancer risk assessment tool, and then were followed conservatively till they die. And what this study showed is that Prolaris added dramatically to all the other tests we do in assessing risk in men with prostate cancer. And the combination of the standard test plus Prolaris dramatically enhanced the ability to predict who actually was going to die of prostate cancer. This is very important because it showed, and we had two prior studies that suggested the same results, but in this study, because it's more recent or more contemporary, the patients were more like current U.S. diagnosed patients. And as you're probably aware, prostate cancer has a problem with over-detection and over-treatment of many men, but also an under-treatment phenomena. So we'll diagnose prostate cancer in about 250,000 men, and about 30,000 men will die. What we want to do is decrease the over-treatment in the majority of patients, move them to more conservative management, and treat more aggressively the patients that really have a cancer that may end up shortening their life. What this study shows is that Prolaris was very, very accurate when combined with standard tests in predicting who actually had a cancer that would kill them. So it really was, I think, an important new advance in our research studies, and this is the 9th validation study. The second part of the equation is, does it make a difference? And what we've shown now in a study that was published in February in CRMO is that when we ask a doctor who's an experienced user of Prolaris how they're going to treat a patient before they have the test result, and then we ask them after they've got the Prolaris test result, and we asked them how they're going to be treated, we wanted to know, was there a difference? Because if there was no difference, there's no point in ordering the test. Turns out in that study, 65% of patients had their treatment change from what the recommendation was going to be before Prolaris to after. 25% of men went from less aggressive therapy to more aggressive therapy. So they increased their treatment based on the fact that the Prolaris said the cancer was more aggressive than the doctor thought before the test. And 40% decreased their therapeutic burden. That is to say they were going to initially be scheduled for radiation therapy. The Prolaris test showed less aggressive cancer than they may have gone on to active surveillance, as an example. So it moved in both directions. And then another paper from a study based at the University of Iowa, where we've used a similar gene signature to Prolaris to predict who is going to develop metastasis in renal cell carcinoma, the typical cancer of the kidney. We showed that we had a very significant ability to predict metastasis in renal cell in men treated with a nephrectomy. And I think we're going to continue, based on that study, to have a much more extensive investigative program into the use of a gene signature like Prolaris in renal cell carcinoma.